Hello, my name's Sean. I'm going to be your nurse today.
Hello.
What's your name?
Brooklyn Gilford.
Brooklyn. Okay, Brooklyn. What's your year of birth?
1906.
Okay, and do you have any allergies?
No.
All right. I'm going to have you go change into this gown and get a urine and stool specimen, and then you can just leave the specimen in the bathroom and come back change. All right, Brooklyn. To start out, I'm going to have you read some words. Can you read that sign for me over there?
We're at,
The white sign right there.
oh, NPO.
Thank you. That's cranial nerve 2. And I'm going to have you do some range of motion for me. So keep your arms out like this. And do some small circles and bigger circles. All right. And can you leave your arms out and close your eyes for me? All right. You can open them. That's cranial nerve 8. And then raise one leg for me. And then the other. All right. And then sit down for me, Brooklyn. I'm going to give you 3 words to remember. I'm going to ask you to repeat them for me later. Apple, ball, and cat. Can you repeat those for me?
Apple, ball, cat.
All right, thank you. And now I will have already washed my hands and prepared the room. Put some gloves on. All right, Brooklyn, we're going to start off with some little exercises. So I'm going to put those on. All right, can you take your hands like this for me and flip them over, and then faster? Thank you. All right, and can you go like this for me, and then faster? Okay, and then can you grip my fingers for me? Thank you. I'm going to test your reflexes, so I'm just going to hit you right below your knee. Thank you. That was a good one. All right, Brooklyn. I'm going to assess your head. Is it okay if I touch you? All right. Just looking at your scalp and everything. All right. Can you push your head against my hand? And then will you roll your neck for me, Brooklyn? Like this. Thank you. Alright, I'm going to feel your lymph nodes. This is the occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, and this is the anterior cervical chain and the posterior cervical chain, and then the supraclavicular. Alright, I'm going to feel your sinuses. Do you feel any tenderness, Brooklyn? Okay. I'm going to look inside your ears. Do you feel any tenderness on your ears?
No.
Okay. Okay. Look together. Any tenderness over here?
No.
Okay. Look in your eyes. Thank you. I'm going to flash a light in your eye, Brooklyn. Just try to keep it open for me. Thank you. Okay. And then will you follow my pen for me, Brooklyn? Alright, very good. That was cranial nerves 3, 4, and 6. I'm going to look inside your nose. Thank you. Then can you hold one side of your nose and blow for me? And then the other side. Thank you. And then can you open your mouth for me, Brooklyn? We say aw. That was cranial nerve 9. And then will you put your tongue to the roof of your mouth? Thank you. And then can you smile for me? Frown. Cranial nerve 7. And can you stick your tongue out for me? And then to the side. Thank you. That's cranial nerve 12. And will you shrug your shoulders for me? Cranial nerve 11. Feel your trachea. Can you swallow for me? It's It's cranial nerve 10, or you could do the gag reflex, that's also cranial nerve 10. And then, will you open your mouth for me, close, and then grit your teeth, cranial nerve 5. You've done everything for your head. I'm going to check your pulses. This is your carotid pulse. And this is your temporal. Okay, very good. I'm going to check your arms. Okay. I'm going to check your pulses on your arms. This is your radial pulse. Wait, this is your ulnar pulse, I'm sorry. Radial. And the brachial. Okay, very good. I'm going to check your skin turn over here. Very good. I'm going to come behind you, Brooklyn, and listen to your lungs. Take some deep breaths for me. Alright. Very good, Brooklyn. I'm going to whisper a word in each ear. Can you just repeat it out loud for me?
Cat. Dog.
Alright. And then I'm just going to put my hands on your back here. If you take a deep breath for me in your nose, not your mouth. Thank you. And then the whisper test was cranial nerve 8 also. Alright, Brooklyn, can you go ahead and lay down for me? I'm going to listen to your lungs on the front now. Take some breaths for me. Keep out for me a little bit, Brooklyn. Thank you. Alright, now I'm going to listen to your heart. And then you're going to have the aortic, which is in the second intercostal space on the right sternal border. And then you're going to have the pulmonic, which is the second intercostal space on the left sternal border. And then you're going to have the tricuspid, which is in the fourth intercostal space on the left sternal border. And then you're going to have the mitral, which is on the fifth intercostal space, left midclavicular line. Okay, very good. Just going to press down and check for any lifting or heaving. Alright, Brooklyn, I'm going to look at your abdomen. Are you feeling any pain or tenderness? And normally I would lift up to look at the abdomen. Alright, I'm going to listen to it for you, Brooklyn. Just let me know if you ever feel any discomfort. Alright, now I'm going to press down on your stomach, Brooklyn. You might feel a little pressure. Just tell me if you feel any pain. Alright, feel any pain or anything? Okay. Next I would check the femoral pulses. check your legs, Brooklyn. You feel, look for any edema. Can you pull your legs up against my hands, and then against my hand on your arms. All right. I'm gonna check your popliteal pulse. Okay. Your dorsalis pedis. And then your posterior tibial. Alright, we're going to check your capillary recall on your toes. She has socks on. And then when you push your hands against your feet against my hands. Thank you. Okay, Brooklyn, I'm going to do a sensory test on you. I'm just going to poke you a little bit, tell you what you're going to feel, and then afterwards you're going to tell me what you feel and where you have it at. Just close your eyes for me. This is soft. This is sharp. And this is dull. Okay?
Soft right leg. Sharp left leg. Dull left hand. Sharp right hand. Soft forehead.
Very good, Brooklyn. You can go ahead and open your eyes. You can sit up for me if you'd like. Just going to check over my paper and make sure we got all the information we needed. Alright, Brooklyn, can you recall those 3 words for me I gave you at the beginning?
Apple, ball, cat.
Alright, Brooklyn, thank you. I'm going to go check on your urine and stool specimen. If you have any questions, you can just let me or the doctor know. Thank you. Then I would remove my gloves, wash my hands. I'll get a new pair of gloves. I guess you just, can you see the mannequin in the video?
No.
Okay, just go ahead. Give her a second to get set up. Okay.
I'm a terrible cameraman. Alright, that's good. If you stand a little bit to the right of it, it'll be good. Yeah, that's perfect.
Okay. I will wash my hands, put on some gloves.
There's gloves right there.
Oops. All right, Mr. Doe, I'm here to do your assessment. My name is Shauna. I'm just going to be inspecting it first, and I'm just going to be looking, so. All right, I'm going to touch you and move your penis out of the way. All right, I'm gonna feel it around. You're gonna feel a little bit of pressure. Tell me if you feel any pain. And then you would move the foreskin back and look for any lesions. Move it forward. Speed on the end for any discharge. Where you would do the scroll exam. Alright. And then you do the anal leak. Alright, that's all. Thank you so much. If you have any questions, just let me know. And the doctor will be ready to see you. And then you remove your gloves and wash your hands.
Done? Okay.